Well, hello, ladies and gentlemen. Welcome to our Hair Wellness Initiative. I'm Deepthi Diwan, and it's my pleasure to be your host today. Our hair is our crowning glory, and it makes a world of a difference to our appearance. However, our hair requires special care and attention, especially in the harsh winters. And for those of us who are facing issues relating to our hair, it's time to meet the expert. And today, our expert is none other than Dr. Kamal Jamnani. Well, let me tell you about him. Dr. Kamal Jhamnani is a senior consultant dermatologist and trichologist at Abhirid Specialty Clinic in Secunderabad. He's practicing since 11 years with special interest in medical and pediatric dermatology and also trichology. He has given several lectures in state and national conferences, and he's involved in various studies and research papers. Dr. Jamnani is also involved in presenting skin and hair related talks in various corporate institutions. He has catered to the needs of the patients in the most outstanding manner and is known to keep abreast with the latest inventions in medical science, offer the patients treatments that are of the best and highest quality. And Dr. Jamnani has been kind enough to join us today and answer some questions for us. So without further ado, I'd like to welcome Dr. Jamnani. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So doctor, we are going to be discussing hair care, especially in winter.
Thank you.
One of the most common conditions people face
Yeah.
during winter is that of dandruff. So please tell us what exactly is
Yeah.
that?
Yeah. Hello, Deepthi, and glad to talk to you this evening. And see, dandruff basically is a excessive proliferation of the dead skin. It's a final common result of various reasons. So it can happen. There's something called as physiological dandruff, which is just an excessive flaking of the skin happening to some extent related to a dry skin. And sometimes there is an associated fungal infection in that plays an attributing role. So it's our body's defense mechanism to kind of throw the fungus out by exfoliating the skin. And particularly in winters, because the skin tends to get dry very easily, so that's why the dandruff tends to increase. Yeah.
Absolutely. So, what is the link between dandruff and winter? Most people who suffer from dandruff really dread this season of winter. So, what is the link between that?
Yes. So as such, winters are known to make the skin dry, just like the skin on the body gets dry. Same thing happens on the scalp as well. But except for maybe places which are way too humid, otherwise most of the parts of the country, the skin tends to get very dry. And because of this dryness, there is an excessive proliferation of the skin happening to compensate. Our oil glands try to compensate for it by overacting, and in the process sometimes there is a blockage of the oil glands which sets in, and that triggers a little bit of fungal colonization in that blockage, giving rise to this kind of dandruff, and that's why it tends to aggravate. So hydration does play a role to a great extent in counteracting the dandruff, especially in winters. Also, one more thing is we need to identify, is it truly dandruff that we are referring to, or is it just an excessively dry skin? So that also needs to be checked upon. Yes.
Thank you for that, doctor. And what is the difference between dandruff and seborrheic dermatitis?
Seborrheic dermatitis is like a higher and in the same spectrum, like dandruff, what we call it's a part of a spectrum of diseases. The mildest form being just a mild flaking to a little bit of dandruff. As the manifestation or the severity goes on increasing, eventually at the higher end of the spectrum, we have what is called as seborrheic dermatitis. That also is infection only, the dandruff infection, but with an excessive element of inflammation on part of the body. So our body goes overboard, our immune system goes overboard trying to throw the fungus causing dandruff out, and that gives rise to this kind of excessive inflammation with apparent scaly flakes on the scalp and with a little bit of oozing too. So that constitutes the seborrheic dermatitis.
Okay. So you're saying that dandruff is a milder form, whereas seborrheic is more aggravated form of the same kind of. Uh,
Aggravated form. True, true. Yes, yes.
and
Mhm.
so, doctor, what external factors are associated in causing dandruff? Is there anything that we can do? Certain things that we can take care of?
Uh, Yes, yes. See, as we discussed, that dryness does tend to aggravate it, and then to a great extent, it's also a mild degree of fungal infection. Ultimately, there is a fungus called Malassezia, which is ubiquitous. It's there everywhere, and the manifestation of that particular fungus depend on multiple parameters. It depends upon the severity of the infestation. It depends upon our immune system. So all of them do play a role. So maintaining a clean scalp is what we can definitely do, like regular washing. It need not always be with an anti-dandruff shampoo, but a more frequent washing helps. Sharing of caps has to be avoided. Sharing of combs has to be avoided. Sharing of helmets has to be avoided, because these are the things which can act as an aggravator. Because ultimately, anything which spreads an infection will act here as well. So a personal hygiene for on the scalp does play a role. Okay, so that helps.
Okay. And how about exposure to sunlight? A lot of people believe that, too much exposure to sunlight may also cause dandruff. So do you think, I mean, would you recommend
Hmm.
anything for that?
So anything in moderation is good. Excessive sunlight, sun exposure in an attempt to kind of get rid of the fungus, going overboard, very severe sun exposure can ultimately lead to an element of a kind of irritation on the scalp, some kind of an eczema called polymorphic light eruptions. That also causes a little bit of flaking. So then we would be confused as to, is it really dandruff which is causing so much of flaking, or is it some degree of secondary eczema which is also coming into play? Sun exposure in moderation is definitely advantageous, because that kind of boosts up our immune system. It helps us. So that way it is definitely good. And being a natural sterilizer, sun exposure also, because of by virtue of the heat generated, will kill the fungi. So in moderation, it definitely serves as a protective role. But overboard, then it might cause other problems as well. So in moderation, yes, I would surely say that a little bit of sun exposure would benefit.
Okay. Thank you, doctor. And what is the cause of dandruff? What is the etiology of dandruff?
Yeah, it's basically a combination of factors. It's the fungus per se, the Malassezia fungus. But as I said, not everyone being exposed to the fungus does develop dandruff. So to some extent, it also depends upon the person's immune factors as well. Our immunity, how healthy is our scalp. So people who have been oiling the scalp regularly, to some extent, have lesser dandruff. Like again, here it's moderate oiling, not too much of oiling. Again, acts as a medium to entrap the fungus. A little bit of oiling on a regular basis, regular in the sense weekly, maybe 1 or 2 times. That it need not even stay continuously. Even if a person just wash off at night and then apply oil in the night and wash off in the morning, that also suffices. So the hydration of the scalp forms a protective coating that doesn't allow the fungi to kind of penetrate. So it does have a protective role. So the fungus, the state of health of the scalp, the cleanliness that the person adopts. So all these factors come under the etiology of dandruff. Yeah.
Okay. And what is the role of microorganisms in dandruff?
Yeah. Yes. So there is a lot of studies going on as to the severity of dandruff and the microbiome of the dandruff. In fact, there are books written on dandruff as well. So like all around, we have microorganisms surrounding. We have bacteria, fungi, and whatnot. So our skin acts as a protective barrier function, has a protective barrier system which doesn't allow things to penetrate. Now, once there is an element of dandruff, it causes a little bit of itching or dryness or flaking. And in the process, what happens? It becomes amenable to secondary infection. So we have these organisms which are freely moving in the in the atmosphere. Like there's something called as Staphylococcus epidermidis, and so many other microorganisms which are waiting to attack, but they are otherwise not able to penetrate an intact skin. So, in a scenario like dandruff, because of the itching, they can form an avenue of entry of the bacteria into the skin, and that can form a secondary infection. That's why, if you observe, some people with dandruff along with itching, they also develop small pus-filled lesions as well, which are quite painful. So that is like a secondary infection. The bacteria which are otherwise not able to penetrate, they are able to now enter into the scalp. Yeah.
So, you're saying that hydration of the body in terms of drinking a lot of water and hydration of the scalp in terms of oiling regularly, these are some of the things that we can look into. And
Mhm.
apart from that, yes, not sharing of
Yes.
combs and caps. These are some of the things that a lay
Yes.
person can do
Yes.
to avoid getting.
Mm. Yes.
And a lot of people also suffer from hair loss. So, what is the relation between dandruff and hair loss?
Okay, so hair loss is again a totally different entity. There are so many causes, both genetics, environmental, the food, vitamin deficiencies. All of them do play a role in aggravating hair fall, and among them, dandruff is an independent risk factor for an aggravation of of the hair fall. See, what happens is whenever there is already an pre-existing hair fall for any reason, be it nutritional or be it genetics, then the scalp is quite sensitive. The hair follicles are quite sensitive. So any degree of colonization, I mean the growth of the fungi at the hair root, that compromises the hair root still further. An already compromised scalp gets further damaged, and that can aggravate the dandruff, aggravate the hair fall. So dandruff per se is, I would say, an independent risk factor for an aggravation of hair fall in a person already having hair fall issues. But yes, in a person not having hair fall previously, dandruff can also cause hair fall, but to a lesser extent. But if they are already been having hair fall for some other reason, then it acts as a aggravating cause, and the hair fall suddenly increases.
Okay. And so, doctor, I think from whatever you have shared so far, it would not be wrong to say that diagnosis is very important because of multiple reasons can create multiple causes. So, correct diagnosis is very, very important. And once you diagnose, then whichever kind of dandruff it is, what is the kind of treatment that is available to people?
Yes. So, like as I said, it's like a spectrum. My very mild cases would hardly need anything beyond more frequent washing of using their regular shampoos. But when someone has a little more severe dandruff, then I would probably prescribe them an anti-dandruff shampoo, maybe twice a week to start with, and as maintenance, maybe once or twice a month, just to go keep it going on. And when it's really severe, then we shift over to anti-dandruff lotions as well. So the difference between a lotion and an anti-dandruff shampoo lies in the contact time. An anti-dandruff shampoo is hardly on the scalp for maybe a minute or two, at the most maybe about 3-4 minutes. A lotion, on the contrary, is an overnight application, overnight to maybe a few hours. So that has a longer contact time. So it tends to act much better in terms of clearance of the dandruff. So again, it all depends on the severity. Previously, we used to prescribe anti-dandruff or antifungal tablets also as a part of the treatment. But nowadays, with the advent of availability of lotions, especially the overnight solutions to be applied, we hardly feel the need to do that, because the lotion, by virtue of its longer contact time, has been able to give a very good reduction. Yes. Mm.
Okay. Well, thank you so much, Dr. Jamnani. That was indeed an insightful and very informative talk. And anything else that you would like to share, Doctor, for all the viewers? Any other suggestions that you may have for them?
Uh, other suggestions, in the sense, the most important being the hygiene. And then I would say, don't forget the grandma's wisdom of applying oiling once in a while. That is definitely helpful. because I see more and more of, especially teenagers. The moment I see them and I ask them about oiling, they say, no, we don't do that. And so I tell them, do that. That does have a protective role. And shampooing, again, no, don't use shampoos very, very frequently. And maybe alternate days is also fine. It all depends upon the person's occupation. And also don't scratch it too much, because I see people literally, because in the scalp there are lots of itch receptors, especially people with dandruff of a long duration. The more they scratch, the more it itches and forms a cycle, and ultimately it leads to infection, and which requires antibiotics and other things. So these things, and try to not share combs, caps, helmets, and everything. That's it, and things would easily settle down. Hmm.
Right. Well, thank you so
Yeah.
much for sharing so much information, all your expertise with us, and for answering all the questions of our viewers. I'm sure the viewers have really found this session very helpful. So thank you. It was a delight to have you with us, Doctor. And thank you once again for your valuable time.
Thank you, Deepthi, and thank you all the viewers for watching. Take care. Thank you.
Thank you. Thank you, Doctor. Thank you, ladies and gentlemen, for joining us. And this is Deepthi Diwan, your host, signing
Yeah.
off for today.